And just in 1970, so I remember I graduated high school approximately then, it was 64 years, which is really dramatic. And for white people, life expectation rose from 72 years to 79 years. And as I alluded to before, in 1930, life expectation for blacks was only 48 years.
Wow.
So you think back not so long ago.
Yeah, it's not too long time ago.
Most people's grandparents' age, they were living 48 years on average, blacks, 60 years for whites. Infant mortality, so babies dying, were a big part of the gap in the black community. And the infant mortality rate fell by 16%. And heart disease still is the biggest deterrent or drag on black life expectancy. So of the 3.8-year difference between blacks and whites, 1 year was due to heart disease. And the second was, take a guess.
Diabetes.
Cancer.
Okay.
Cancer. And about 8 months was due to cancer. So again, it talks about what you need to do to get screened for cancer and reduce your cancer risk. One thing was what we just talked about earlier was getting CAT scans for smokers, trying to find those cancers. Lung cancer is one of the top killers in America. So if you really find that cancer, detect it early before it spreads, you'll change the natural history of the patient's life. So those are two interesting studies that came out this week. I want to talk about some interesting patients that I spoke to this week, and those are new. One is a man who just called me from Israel, and he had an acoustic neuroma. Do you have any idea what that is?
Not a clue, doctor.
Well, acoustic. Guess what acoustic is?
Sound. Something to do with
sound and neuroma.
I don't have anything for you there.
Okay, so it's the nerve that carries sound in the brain.
Okay.
So you can get a tumor of the nerve, and it's usually a benign tumor called an acoustic neuroma.
Okay.
And this man came to us 15 years ago. He's a music conductor. So you can imagine, here's a music conductor who's losing his hearing, and his tumor is almost 4 centimeters, 3.8 centimeters in size.
Is that quite large?
Yeah, it is quite large.
Okay.
So 1 inch is 2.54 centimeters, so 3.8 is almost an inch and a half.
Right.
So imagine in your brain to have an inch and a half, and I'm showing John what an inch and a half is like, that doesn't belong there.
Yeah, certainly something I would take very seriously.
Okay, so the brain is locked in the skull. The skull doesn't usually move, so as tumors get bigger and bigger, they push on the surrounding tissues.
Right.
So there's something called the brainstem in all of us humans, and the brainstem is probably the most primitive part of the brain, but probably one of the most important parts of the brain. So as a tumor gets bigger and bigger, it not only harms the hearing nerve, but also the adjacent nerves, the facial nerve, which controls the face, and the trigeminal nerve, which controls sensation to the face. The facial controls movement of the face. So most parts of the body have one nerve that moves it and another part that senses.
Right.
Okay, so as the acoustic neuroma gets bigger and bigger, it can cause more and more harm. So with surgery, most people who have surgery for acoustic neuromas lose all their hearing. So for this music conductor, this man is exceedingly sensitive to sound. He plays the violin. He conducts an orchestra in Israel. And the last thing he wanted was to lose his hearing. So I remember vividly calling him in Israel. It was daytime in America. It was midnight in Israel, and told him that we reviewed his case and we thought he was a proper candidate. And he actually came for treatment 15 years ago. We have a lot of patients coming from overseas. And he had 5 treatments. So we have a unique program for acoustic neuromas, and it's called fractionated brain radiosurgery, where we send in beams of radiation to hit in this case, a benign tumor. And we treat a lot of benign tumors. And so now he called me yesterday to follow up. And the answer is, we can imagine what the answer is. He's doing great.
Good.
His hearing was restored. His hearing was fully restored. So the tumor was able to shrink down and get pressure off the hearing nerve. So he has bilateral hearing. A lot of times we don't think or we take for granted bilateral hearing, but when you have bilateral hearing and you're walking down the street and someone honks at you, you know if they're coming from the right or the left or front or behind. So it improves your quality of life a lot. And it means that you can talk to people on either side of your body, right or left. It means you can even save your life if you're walking across the street and the car's going to hit you and someone shouts, "Watch it." If you don't have stereo hearing, you don't know which way to watch it.
Right,
you know?
right. No direction.
And there's no direction. So stereo hearing is a major quality of life issue that many of us take for granted. So this man certainly doesn't. He gets MRI scans on a regular basis to show that the tumor has been receding over all these years, keeps on shrinking. He's done well. And our studies actually show we haven't had any recurrences after 5 years.
Wow.
So our success rate for acoustic neuromas is about 97%.
Outstanding.
Yeah. So we have actually the world's largest experience with fractionated radiosurgery for acoustic neuromas. So it's an interesting disease. We're going to take time out for a break from our sponsor, and we'll be back with some more interesting news and cases.
Looking forward to it.
For new or recurrent brain tumors, Radiosurgery New York specializes in non-invasive radiosurgery. First in New York with painless, fractionated brain radiosurgery, we have decades of expertise in brain tumor treatment. Hi, I'm Dr. Gil Lederman. Critical to every patient, every family are results and quality of life while avoiding radical surgery. Our brain radiosurgery may be used even if prior surgery, chemo, or radiation didn't work. And our radiosurgery experience includes treating thousands with brain metastasis, glioblastomas, acoustic neuromas, meningiomas, and more, with no cutting, no bleeding. Our brain tumor treatment is outpatient with most insurances, Medicare, Medicaid accepted. A fresh second opinion could change your life. For brain tumor treatment, call 212-CHOICES. 212-CHOICES. Radiosurgery New York. Super conveniently located in Manhattan at 38th and Broadway, hits the brain tumor. Call 212-CHOICES, 212-CHOICES to hit the brain tumor. For prostate cancer treatment, results and quality of life matter. Hi, I'm Dr. Gil Lederman from Radiosurgery New York. Our enviable record includes treating thousands with prostate cancer. Critical to every man with prostate cancer and their loved ones is quality of life, urinary and sexual, and great treatment data while avoiding surgery. Treatment here is outpatient, with most insurances, Medicare, Medicaid accepted. First in America with radiosurgery for cancers from head to toe, we have the expertise to hit the cancer. Our fresh second opinion could change your life. For prostate cancer treatment, call 212-CHOICES, 212-CHOICES. Radiosurgery New York, super conveniently located in Manhattan at 38th and Broadway, hits the prostate cancer. Call 212-CHOICES, 212-CHOICES to hit the prostate cancer.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Good morning. Welcome back, John. How are you?
Great, doctor. How you doing today?
Fine, thank you.
Wonderful.
So there's more news. There's more cancer news. Did you hear about Michael Douglas and his cancer?
Very little. What I read in the Post.
Okay.
And I really can't tell you too much about it.
Okay, so a few weeks ago, he